Hi, everyone, and welcome to another episode of the Academics Anonymous podcast. My name is Miguel Velasco, and I'm going to be your host today for an interview that we have with nurse practitioner Lori Guelman. So, Lori is a nurse practitioner at Stanford Healthcare. She has a website with a biography, and I'm going to go ahead and read off the biography so you all have some information about who she is before we get into the interview. So, Lori recently took on the role of a lead advanced practice provider APP for Stanford Urologic Oncology and Radiology Oncology clinics. Prior to this, she worked in general urology for over 12 years, and Lori has presented at numerous local and international conferences on topics ranging from overactive bladder, dysuria, and neuromodulation to pain management and the role of the NP. She was most recently invited to speak at the APP section of the American Urological Association's 2019 annual conference on antibiotic resistance. Her research on simple cystitis and antibiotic stewardship was recently published in the November-December 2019 Urologic Nursing Journal affiliated with Society of Urologic Nurses and Associates, or also known as SUNA. Lori is currently a co-facilitator for the ACES Relationship-Centered Communication Workshops, as well as a faculty for the APP Mentorship Program. Lori has been very active in the Stanford APP community and has recently stepped down as the former chair and faculty for the Stanford Healthcare Controlled Substances Program, as well as the APP Quarterly Newsletter and APP Awards Committee. Lori is the past president of the Golden Gate chapter / San Francisco chapter for the California Association of Nurse Practitioners, in which she completed 2 terms. So, as you all can tell, Lori is a very esteemed individual with many accolades, and I am very excited to get the opportunity to chat with her today. I'm sure you all can benefit from just hearing a little bit about what she has to say about medicine and her practice. So, without further ado, this is my interview with nurse practitioner Lori Guelman. Lori, it's awesome to have you on the podcast. I just wanted to give you maybe the chance to first introduce yourself.
All right. Well, thank you. Thank you, Miguel, for having me on. My name is Lori Guelman, and I'm a nurse practitioner, a lead advanced practice provider at Stanford Healthcare in the Cancer Center, Uro-Oncology and Radiation Oncology. Wow, let's see. I've been in this position for about 5 years. I think I got the job just as COVID hit, so that was an interesting transition into the management position. Before then, I spent 12 years working in general urology. So I feel like I have the whole kind of spectrum of urology, which is really great because in uro-oncology, we actually do see a lot of patients that overlap with the general urology portion as well. Yeah, so I started at Stanford right out of nursing school. Um, it was kind of a sink or swim. When I took the position, the nurse practitioner was going on maternity leave. And so I literally came into the role with as a new student perspective. Um, so it obviously panned out. So I think I'm it worked out well for me.
Awesome. Well, I would like to first kind of understand how you got to where you are. So could you tell me a little bit about your path to urology? I think that was probably an interesting um, development for you, an interesting pathway for you.
Because you don't just wake up and say, I'm going to go into urology.
And yeah, most people
So,
don't.
yeah, so it's interesting. I actually I got an undergrad. I went to Davis, and I ended up after Davis, I worked in actually medical marketing in San Francisco for a period of time, and that was a really great position. I got to see behind the scenes putting together, marketing materials and educational materials for branding for companies like Genentech, a lot of pharmaceutical companies. So that was a really interesting perspective, and I had fun doing that. But it didn't quite hit the mark with what I wanted to do as far as helping people. So I ended up going back to public health. I went to San Jose State, was getting a master's in public health. Um, and again, I didn't feel like that was quite the niche I was looking for. I really wanted to be hands-on, patient-facing, and so um, that's when I started thinking about going back to school to be a nurse practitioner. And then I ended up going to Samuel Merritt Great experience. And then afterwards, I think I just was looking for jobs and I just threw everything out there. Whoever wanted to interview me, I was willing to take. This opportunity came to me, and I didn't really know much about urology. But I have to tell you, the interview process, I met the most amazing people who I now work with. And I said, this just feels right. So I took the chance, and I have to say, I think I love working in urology. I love it because I think there's a lot of education. And I think the role of a nurse practitioner plays really well in this specialty because really it's just an incredible amount of information and understanding. And, in general urology and, of course, oncology. But I think in general urology, there's just so much that people can do on their own that can really help them. And so I really enjoyed when I was in general urology. So that's how I got to this place. And then after 12 years, the somebody kind of tapped into me to see if I wanted to take on this lead role, which would be also kind of doing clinical, but then also working with having APPs, managing APPs, and taking on more projects. And I thought that was a nice time in my life to transition to this role, and I'm really glad it actually really opened opportunities for me to help out in areas that I didn't think I'd be able to if I was just 100% clinician.
Oh, wow. Interesting. So it almost sounds like you found yourself in urology through opportunities that kind of just popped up to you. Yeah.
Yeah, that's exactly it. I mean, I think in general urology, towards the end, I was really balancing everything out well. I actually even published a paper, which I don't think I would have done if it wasn't the right time there. I had the right support, and then right after that is when I got this opportunity. And since I've been in this role, I've been doing a lot of quality improvement projects and workflow improvements, and I don't know if you're familiar. I've been doing this group pre-op that I've started working on, where a lot of our patients, surgical patients, a lot of them have the same questions and just need the same information. And so I've been putting together sessions where we're all able to, so you can have up to like 7 patients on the meeting, and it's all HIPAA confidential within uh, the parameters that they need to be in. But it's really proven to be a great initiative. And so I'm excited about that, just as far as really being something important to the patients because they get a more comprehensive picture instead of just having a one-on-one appointment. Now they have the team. So they have physical therapists, they have social work, they have other specialists involved with the whole surgical process that are actually on the call. And then, people get to ask questions, which other people may not have asked, but they obviously are going to benefit from them. And just knowing that you're not alone, you're going through this, and so are other people. And so, that's really speaks a lot. So I think it's been great. And I just, I started having this group pre-op session with 2 patients because nobody wanted to do it. And we learned how to kind of make it work for everybody. And now we're maxing out. So we're doing it once a month. And yeah, I'm really proud of it.
Yeah, that sounds great. It sounds like people are really feeling like the care that they're receiving is comprehensive. Um,
Yes. Comprehensive, and I think they're getting all their questions answered because the other part of it is, we want to make sure they get all the information out so they don't have to keep checking back in with us because I think that's not helpful for them. And so I do think we're getting everything out there that they need ahead of the procedure.
well, I think that all you do over there is really awesome. I am really curious though. So specifically for oncology, it sounds like you kind of found yourself moving towards urology because of this position that kind of opened up. How did you make the transition towards working with cancer patients? Was that something that you were particularly interested in?
Yeah, it's actually a great question, and it's quite the opposite. I never was looking towards oncology because I thought, wow, that is, it's a very somber topic, and again, the opportunity came to me. Once it was presented to me, it then got stuck in my head, and I couldn't get it out, and I felt like it's something I really needed to do. Now, in hindsight, having been in this position for over 5 years, I think I was meant to be here because it truly is like people just, it's a big lack of understanding or lack of the unknown that just it provides stress and anxiety. And we are in this position where we can really help navigate people through this process. And so, again, APPs are, the perfect providers because we have a little bit more time. We have, we want to educate, we want to help out. And so, it just kind of, all the ducks were in a row.
So I'm curious to know, a lot of people are probably listening to this podcast and they are interested in going in the healthcare field. They may be interested in going down the NP route or down the RN route or some other health professional field. Um, I'd like to know who you felt were your significant professional supporters, and maybe they might seek advice or guidance through those same kind of people too. So who were your significant professional supporters?
My significant professional supporters. That's a good question. I think through the process, it's just when you're, even as a patient, we're all patients as well, right? And every time you have an interaction with somebody, it's very meaningful, whether people realize it or not. And so every time that I met a nurse, in any situation, and there was a time when I was younger, I was in a car accident, and what stands out for me, and I don't really, I'm sure there's a lot of details, but the only detail that actually I recall is how the nurses were to me and how they were so caring and so supportive, and it really took away a lot of the fears that I had. And so I think just through life, that's always stuck with me. I think when I was trying to decide, is nurse practitioner the right role for me, I did a lot of shadowing. I remember going to UCDMC, the ER. I went to a lot of clinics, and I just saw how the nurse practitioners interacted with patients. And I think, I love to talk and I love to educate. And I think just seeing like, wow, being able to put these two together with the clinical aspect, it was just like this is what I was born to do. So I think, the support of the RNs, growing up and just seeing, how they kind of help patients in the process. And then, the other components, because I do know a lot of people said, why don't you go to, medical school, and, or why didn't you do this, or why didn't you do that? And I just think, I don't know, sometimes I feel like this is where I'm meant to be. I didn't ever actually consider going back to school to be a physician. That was never really my intentions. Somehow it just always felt right to be in this role.
What kind of things do you consider when you're treating a patient? Like, what's your approach towards patient care? Is it a very humanistic approach? Are you trying to look at the full picture and be comprehensive with things?
What is my approach? And so basically, you get to that door and you just, or just clean slate. I, you know, I just go in and I always take a deep breath, and I'm I think just a very clean slate. I'm knowing that these patients have cancer, and I think I treat everybody basically as if how I would want to be treated. And I always need information, the way I am. And so I really want to give people as much information as I can so that they have a full understanding. Once I get in the room and I kind of read the patient, then I do it at their level. Some people are, need it at a more medical level. Some people are, really need it just as simple and easy as possible. So I get to know them. We kind of check in and have, a question about, their life or where they live or something, just to kind of understand, where they are, what they're coming from. And then as I'm talking to them, I gauge my conversation to how I think they're best going to learn. What I have done in the past is that I learned patient-centered care is kind of my approach. It wasn't always my approach, and I have learned to get here. Early on, we have this much time to see a patient, so I would go with my agenda, and I get in there, and I didn't really ask them their agenda, and I'm sure that's kind of frustrating, right? Because again, as a patient, I want to make sure I'm heard, right? So in time and building a lot of these skills, it's basically come down to the fact that I'm going to go in there and I'm going to say, my agenda is I want to understand the patient's agenda. And then at the end, we're going to answer any questions we can. And then it's a lot of information. And I know this because, again, we've all been patients. And so I always summarize the immediate next steps. And sometimes I'll even quiz them if it's very complicated or it's a lot of information. And I really want to make sure they get certain points going home, which, by the way, they love. And then they feel like they're in school again. And I said, I'm not grading it. And they all think that's funny. Um, but yeah, it's really creating a relationship with them. And you're not going to create a relationship if you don't set an agenda that's going to include them in it. And you don't set create a relationship if they're not on board. And so it's really, really important for me to make sure. Sometimes, patients can be super frustrated because of their condition, because of what's going on, because of these unknowns. And I think with years of experience, I have learned how to really work with that. I know a lot of our younger, newer APPs coming in, or any clinician, it's very reactive, right? This patient's upset, and so you react. And I think with time, you understand that they're not upset at you, they're upset at the situation. And again, it's just kind of reshaping it, reframing it so that they feel empowered and that they feel educated. And it's amazing the difference when you speak to a patient, not at a patient. It's amazing the difference when you use certain words. And it's a game changer. It makes all the difference in the world. And when you have that, you create that relationship, it is so great. And I end up ending these appointments a lot of the time where we're just like, you just feel great, you feel really good. And they have these horrible conditions or cancer, and yet they feel supported, and it's a really good feeling from both ends. And so I think that speaks to the first question. Remind me of the second question.
So the second question was about patient individuality. How does that come into play when you're thinking about their diagnosis, their prognosis, how you're going to treat them?
Yeah. So I think, again, I think it's meeting the patient where they are. So that's the first step. And then I actually try not to overwhelm them because everybody wants all the information from the beginning. What's a treatment? What's my prognosis? And it is such a step-by-step process. I think what they need to understand is, the general spectrum, but especially with for treating prostate cancer, we haven't even done a biopsy and they already want to know when they're getting their treatments. And so it's really kind of reeling them back in and saying, look, this is where we are. First of all, this is prostate cancer, right? This is where we are. And this is the steps involved. But let's just do one step at a time, because you may not even need to get to the treatment part, right? There's a lot of different things that in between. So it's trying to take a step back with them, letting them breathe, giving them the information, because I think it's all about information. If people have the right information, then they're going to get off the call or the appointment, and they're going to feel, okay, I know the plan. A lot of the times they don't get that information, and that's where the anxiety comes, that's where the unknown comes, and that's where they're just in their heads. So I really want to make sure they're very clear with the plan and that they're okay with it. So by the end of the meeting, I will touch base and say, do you have any more questions? Does that make sense? What else can I do for you? And we will not end that call until they feel, okay, I think I'm good. And I think the other important thing to make people aware of is that they are not alone, because I do think in these moments of despair, when you have a horrible condition, diagnosis of cancer, you really go to that place and you just feel like, I'm in this alone. And they're not. They have a full team of people that this is what we do. These are this is our focus. So yes, for you, this is overwhelming and this is something you've never experienced. You're with a team of people who this is what we do all the time. So we are in it together. And I got to tell you, Miguel, every time I say that to a patient, that you are not alone and we're a team and you can send us a My Health message, you see this, like their shoulders sink, like they breathe a sign of relief. People need to know that they have support, that they are being heard. Um, and so I think every time I'm with a patient, kind of summarizing, I meet them at their level. I make sure they have every question addressed, that they're fully informed. And I think this gives them a sense of empowerment to help them in this process. I don't know if that did that answer the question.
Did a great job of answering the question. And I think that it kind of speaks to what I kind of want to get into. I feel like these are all things that it sounds like you learn them through your experience. You're quizzing patients, you're teaching them back, getting them to recite things to you, providing the right amount of information, not overwhelming them. Are these things that you learned through your experience, or were they things that were also emphasized through your education?
I think it's 100% experience. I don't think you can learn these things through education. I think education teaches you the science, the condition, the algorithms, but it doesn't teach you that human interaction, that human approach. And so
Right.
I think, if we would have had this conversation over 17 years ago, my answers would be different. But I feel a lot more comfortable, and I'm still making mistakes, but, I feel like I have really got my groove with how to help people. But yeah, 10 years ago, probably a little rough around the edges, and, probably uh, didn't always say the best things or get what people needed out of the appointment. But I think with tons of experience, and I think with failure in a way, because that's how we learn, right? So with maybe doing it, here's an example. So early on with patients with overactive bladder, I would tell them, okay, caffeine is a bladder irritant, coffee, tea, alcohol, all these things that, people are doing every day. And so I'm like, so you just need to stop it.
Mhm.
And I think they'd leave that clinic visit and they'd probably close the door and they're like, okay, stop it. Yeah, right. And then they go live their life. So over time, I've learned to meet them where they are. So I say, look, these are bladder irritants. What I recommend is that you cut them out by 50% for 1 week. And then if you don't notice a difference, you can go back on it. But it's a trial and error and it's your approach. But you have to give it at least a few days and you have to cut down somewhat. So I'm being more reasonable. And I think that's just kind of symbolic of time and experience, is that I've learned that you can do it one way and they're going to shut their ears, or you can do it the right way and they want to work with you. I also think with time, my approach, just the confidence I've had, has, it resonates. And if people feel that you know what you're talking about, then they're going to respond better.
Mhm.
I think I see that a lot with new clinicians in general. They're not quite 100% certain, and they exude that, and people can see that. So it's one of the things, like, I just want people to feel comfortable and I want them to know that they're getting the best care.
So I am curious to know about this kind of transition that you had from, I guess it sounds like more of a clinician heavy role towards more of a managerial role. How has your experience been moving towards a more managerial role for people that might be more interested in something like that?
Yeah, it's a great question. So so basically I was 100% clinical, and now, part of my time is doing more of the managerial admin role. And it's been a great experience, and it's been a real uh place of growth and development for me. So, I think sometimes we can get comfortable with where we are, and that's not always a good thing, because then you don't challenge yourself. You don't really know what you're not doing. And that's why I've always liked having students, because they always keep me on my toes. So, this has just been a new direction. So, stepping into this role, a lot of unknowns for me. Never really worked with managing people, or mentoring people in that sense, or really understanding what exactly it means to be a manager. So it's been a huge growth. It's actually been challenging, and I think one of the things I've learned is that you should never be comfortable in your role. You should always be a little uncomfortable, and that's, you don't want to be extremely uncomfortable, because that's where you might have too much stress. But to
Right.
be this comfortable uncomfortable is the right place. And so, yeah, sure, initially, like, any new position, you're going to be stressed early on, but I think, 5 years in, I've definitely found my balance. I think i I really enjoy mentoring my team. I enjoy um doing these projects that, that's where the group pre-op comes in. I don't think I would have had the time if I wasn't in this position, or starting, a biopsy program for APPs. And so I think this has really been a nice challenge that I wouldn't have if I didn't do it. So I think it's kind of the natural progression for me to be where I am now. And I just love it. I think every day I learn what I don't know, which is always a good sign. And I have a whole team of people that are helping me understand that and continuing to push me and challenge me. Um, but it's, especially having taken on this role during COVID, that in itself was a nice challenge. Um, we were, in the process, we were supposed to have all sorts of formal training, and that all changed because of COVID. So that was all put aside, and we ended up having to learn on our own. So that
Wow.
was an exponential growth in that moment.
Because you are at Stanford, you do get a lot of support to perform research and any other kinds of research endeavors you may have. Um, I'm curious to know, do you feel well supported at this kind of major hospital to perform research, and how you feel that might be different in something like a private practice setting?
Yeah, it's a good question. So I think, the research aspect is a really exciting part, especially of the cancer center. It just continues to grow and expand. And I think over the past couple of years, it's actually really increased within the APP community. Whereas, maybe before, even 12 years ago, I don't even think I really knew much about the research, except that maybe the physicians were doing some sort of research. Now in this role, it's everywhere. You can't really miss it. And in fact, there's trainings, there's certifications, there's programs that we take, so that we can be a part of the whatever research trials are going on within our clinics. And in fact, there's even workshops. There's an APP workshop specifically for research training. So there's a lot of resources and tools to get us there. And actually, even within my clinics, it's pretty exciting to be a part of these clinical trials and know that we're helping. And when the data is published, or when we're reading about institutions that are doing these trials, and you read Stanford, you feel like you're a part of something really big. It's kind of a cool thing to know that you know we're making these contributions to what the future is going to be. So I think it makes us feel a lot more involved, and a lot more that we're able to give our patients.
Yeah, and for a lot of people listening to the podcast, this is kind of a podcast driven by research, so it's probably inspirational to see that much support given towards anyone interested in pursuing it at a big institution like yours.
Yeah, and you had mentioned private practice. I can't speak to private practice. I
Mhm.
don't know. Yeah, I really don't know, especially with the APP community. I wouldn't think there's a lot of research being done at that level with APP involvement, but I can say at least at Stanford in the past few years, it continues to grow. To see where it's going to be in another 3 years, another 5 years, is pretty exciting.
Cool. All right, great. And I guess now we're going to try to move towards some of the social issues because that's what I've been covering more recently on the podcast. So we try to explore various social determinants of health and how they may impact the quality of care provided to mostly minority groups and also people in different kinds of environments, like carceral settings and things like that. So in line with this common theme, I'd like to ask you a little bit about your experience navigating these social issues as a clinician. Um, you know, what kind of education, I'd like to know, did you undergo as an NP to help you address these social issues in your future practice when you were going through your nursing school?
That's a great question. Now, granted, nursing school was a little while ago. When I won't give you the details on the date, but
Mhm.
I don't recall having any sort of instruction on this, to be honest with you. I think nowadays, if I went back to school, I would think this would be, I think this would be a topic. I think there'd be other topics that were also left off that we're noticing that we're missing. But I don't recall any education on this, to be honest with you. I think it's just something we learned as we started, being in practice.
Yeah, it does sound like it's something that a lot of the research that's out currently on these issues, they emphasize re-education. So I think that's definitely something that's probably gone through some changes over the years.
I do think actually it's an opportunity for workshops or training. I think that these things that were the gaps, we do have ongoing education, so probably not a bad place to add it at this point, because yeah, I do agree with you. we everybody needs to be educated, informed.
I am curious because you work in urology. I feel like it's important to address that there is kind of a social stigma that causes people to sometimes be hesitant to seek care from a urologist or from people in a urology team. Do you feel like this stigma has improved over time?
I don't think so, unfortunately. I mean, so the thing is, obviously, I see the patients who are on my schedule, but I have to tell you, and especially with prostate cancer, um, the statistics are that African American men are they don't seek treatment as much, and so or when they do, it's higher grade, and so we'd like to capture that group early on. Um, but I think there is a gap in care, and there's various reasons, at least according to the literature. It's the history of trust in the medical world, as far as African American men. It's just not getting to be seen by a physician. I think COVID also really set people back, but I think there is still this ongoing trust issue, unfortunately. And I have a friend in the UK who I've been working with. That's where I learned how to do the biopsies, and a big part of his population was African American. And he was telling me that the problem is by the time these people have a biopsy, they're seen so late in their care that it's the PSAs are really high, and that the cancer most likely has spread. And so I'd like to say we've come a long way, and we have, but we have a long way to go.
Right. Okay. And have you seen things that have been successful? Are there things that you feel like would continue to contribute towards progress in this particular issue? What has been your experience?
We still have a long way to go. There are campaigns out there, but to be honest with you, there's just so much information on the internet at this point that I think a lot of it's being blurred. So I don't know what the right approach is. I think starting with primary care, because that is the checkpoint, but not everybody sees their primary care. Um, yeah, I wish I had that magic 8 ball that could help kind of give us more guidance. I'm curious, as a pre-med, what are your thoughts?
It seems like there's different approaches. One of the big ones is outreach programs. I know that Stanford does a good job of promoting outreach. I know that primary care is certainly something that a lot of people push towards improving the education of patients in the primary care setting. Then again, there are some things that definitely can be changed in the current way that we reach out to people that could probably improve how many people actually seek this kind of care. So
Yeah, and I do think that, the outreach to the community as well. So farmers markets or places where people, gather, just having a booth there. I know that, in some places they'll do like blood pressure checks or skin checks. And so having, specific to for prostate cancer, having a booth, in a community where that can really benefit would be helpful. Another thing is in doing my group pre-ops, the group is made of, everybody, of African American, of Caucasian, of Asian. I think that is a great opportunity for everybody to be together, and it's a way to help people with support and trust. So I think group settings, I guess is what I'm trying to say. Group settings are another great option, because individual care, then it's very, I guess, customized. But when you're in a group, everybody knows that you're all getting the same information, the same education. So you're not thinking about it in other terms, if that makes sense.
yeah, it definitely does. And I think that kind of comes back to what you were talking about at the very beginning with making people feel like they're not alone. Yeah.
To feel that they're not alone, to feel that they have a partner in their care,
Mhm.
um, and trust. And I think really building trust, you can have all these things. And if you don't have trust, then, it's going to fall. So we need people to understand that, yes, there's trust, and that we're on their side. We're there for them. Um, it's a struggle and a challenge, and I hope when you become a physician, this is the area that you'll make changes in,
Thank you
or
so
even
much.
before that.
Yeah, thank you so much, Lori, for taking the time to answer a few questions. I'm sure a lot of people that are listening to this will benefit from it and really feel inspired in their future careers and endeavors. Thank you, everyone, for listening to today's episode. I thought it was great to be able to talk with Lori, and I'm really excited for the prospect of interviewing some people in the future. So, if you're interested in hearing from anyone in any particular field, you can leave that down in the comments of this episode, and I will look at all the comments and see if I can get anyone on that fits that description. Please leave a like on this episode and subscribe to the podcast if you are so interested in learning a little bit more about research, science, and medicine. Thank you very much, and I hope you have a great rest of your day.